Well, I'm Dr. Jim Del Rosso, the editor-in-chief of clinical dermatology at JCAD, the Journal of Clinical and Aesthetic Dermatology, affectionately known as the Green Journal by many of you that have long been reading this journal and paying attention to what goes on in the JCAD. So in 2024, we had an exciting year. We had the makeover, the redesign. So the appearance of the journal is obviously different. We have a lot of feedback that it's greatly improved. We've brought a lot of special section editors into the fold in certain subject areas, many of them contributing as best they can. The goal of the JCAD is to provide for the readership and the listeners of what we produce at JCAD, which is obviously printed material available online and hard copy, but also some videos that we do on JCAD TV and others, a diverse group of topics in dermatology. So the focus is on managing patients and improving diagnosis or bringing things to light that'll help you manage patients better. That's a big focus. It's with a lot of tips that are in there in the articles that help clinicians in the trenches. And we that's really the number one goal. But number 1.1 is to bring you other areas that may have to do with access to treatment, management of patients from a logistical standpoint or a practical standpoint, and things that are helpful to the clinicians and also their staff that support them. And we're also bringing surgical tips, surgical pearls, and things that you can actually use that succinctly are there in your office and you can put into your office practice right away to help you. So we're trying to cover a variety of different areas, and that's in the message from the editor in the January 2025 issue, which I'm sure all of you have read from start to finish. Uh, Already, right? So this is redundant. If you haven't, I suggest you do. It'll tell you what's in the issue. We covered a variety of different areas. So one of the focus, one of the emphasis areas of this issue is to bring forth some case studies and case series that point out ways that you can use a variety of different therapies. And we have two in January 2025 that I want to focus on. And these are related to off-label uses of agents that are already approved by the FDA for specific indications. And they include nonsteroidal treatments. I think some of the newer nonsteroidal treatments are improved over some of the ones we've had in the past. And these case series, one of them is topical roflumilast cream for pediatric patients with refractory vitiligo, and there is some information in the literature that supports the use of phosphodiesterase 4 inhibition for vitiligo. And there are four cases of patients that had refractory disease, children, and you can see the use of topical roflumilast being therapeutically very helpful for these four cases of pediatric vitiligo. So that was very eye-opening. And also, there's one with topical tapinarof, uh, which is approved for the treatment of psoriasis, just like topical roflumilast is for psoriasis. Uh, but this is for seborrheic dermatitis. Now, there is a roflumilast foam that is FDA approved for the treatment of seborrheic dermatitis that is obviously out there. It can be used on any of the affected locations, scalp, face, chest, wherever there's seborrheic dermatitis, that is FDA approved. Topical tapinarof is not FDA approved for seborrheic dermatitis, but there's a case series of patients that had facial involvement, and some had other areas such as the neck and the trunk, where the topical tapinarof was very effective for the seborrheic dermatitis. So it provides another alternative that may be helpful in certain situations. It's a cream formulation, so it's likely not going to be as amenable for the scalp, and the scalp wasn't an area that was involved in these cases, but it brings forward other applications of these nonsteroidal agents beyond the FDA approval. There's also an article in there that is a small pilot series utilizing the approved topical a triple combination of clindamycin, adapalene, and benzoyl peroxide, right? That's available for once daily treatment for acne vulgaris in combination with topical clascoterone twice a day. So you have the triple combination topical therapy that has three active ingredients in one formulation that actually, when you look at it in and of itself versus other topical acne treatments, really gives us what what is the highest efficacy in terms of lesion reductions and very, very quickly, not head-to-head comparison, but just looking at trials in similar types of patients really gives us very robust efficacy. But the clascoterone allows us now to address a fourth pillar of the pathophysiology that we haven't had to date with a topical anti-androgen applicable for males and females down to the age of 12. So by utilizing these together, the clascoterone twice a day and the triple combination agent once a day, you're addressing four pillars of the pathophysiology. And that's why I think it's very important that that article is there. It doesn't necessarily address being like a pivotal trial with all of the inclusion methodology that would use in a pivotal trial, but it does show cases of patients that were on the milder to low grade moderate end of treating acne, addressing four pillars of pathophysiology, which we haven't had to date with uh, with a topical regimen. So the clascoterone adds that fourth pillar, and the triple combination gives us very robust activity as shown in those trials. So that is the, I think, the main point of putting that in there and getting people to think about this, and hopefully we'll get more data. Another article I thought is very interesting, something that is not addressed very much in the literature. We hear a lot about post-inflammatory hyperpigmentation or persistent hyperpigmentation for the treatment of acne, especially in patients that have darker complexion to their skin. We know that patients can get post-acne erythema. We typically will see that in patients that have fair skin, but this particular study was done out of Egypt and was patients that had skin phototypes 3 and 4. So they weren't necessarily very, very fair skin. And they compared topical bromonidine gel applied once a day, which is approved in the United States for persistent facial erythema of rosacea. But here it's being utilized for post-acne erythema versus a 577 nanometer yellow laser administered in 4 sessions at 3-week intervals. And they compared these in two groups of patients to look at the outcomes for post-acne erythema. I think this is important because we don't have a lot of studies that address or really solid literature that addresses post-acne erythema. And these researchers did this. They did find them both to be effective, but in their estimation, the laser approach was superior. So I think that's a very important article because it's an area that we don't talk a lot about in dermatology, and we need more information. And JCAD is providing this particular manuscript. There are other areas that have been addressed that relate to cosmetic areas of dermatology that I suggest you pay attention to. Some of these are looking at how patients perceive what's out there on the internet, or when they're looking at videos of potential procedures or approaches, and how that affects the patient in terms of their interest or what patients are actually looking for. I thought that was interesting. One that looked at the internet, and Google is where most patients go. They tend to go to the literature before they're going to have an appointment or after they're going to have an appointment at a dermatology office. And even though they get a lot of information from the literature, the majority still like to get their information from the dermatologist, the dermatology clinician they're seeing, that specialized direct information. So it's nice to know they care about what we think. So that's the wrap on the January 2025 issue. I hope it brings in the new year in a way that's valuable to you. And we look forward to bringing you more and more quality information in our manuscripts and in our videos. Thank you very much.